Hi, this is Asa, and welcome to my audio experience. It's a new prescription for a new you, America. Gail in Denver, Colorado writes in an email, I'm 20 and a student athlete in college. I've been sidelined for a little while with a torn ACL. Do anything that might help the rehab process? Well, it depends. I mean, obviously, hopefully, you had surgery. I'm a big fan. If you do tear the ACL, surgery is a great option. That is where modern medical science comes in, and it is absolutely amazing. Why? Because I tore mine and repaired, and it is good as new. And so I know these things personally. But the surgery itself is great, and there's different options. You can do a graft, which is where they use a graft of your own patellar tendon, which is the strongest, actually, for the repair with the longest recovery, or you can go with a cadaver graft, which obviously would be someone else's, but it works well, and the strength of it will not be as strong, but it's very close, and the recovery time is about half, so that's another good option. So there's a couple of ways that they can do it, and I'll tell you that the surgery is amazing now. The orthopedic surgeons that are doing this are just amazing at it. And obviously the top athletes that get torn ACLs used to be a career-ending injury, and now guys or gals are back on the field or on the court fairly soon and still being able to perform. So pretty amazing. But yeah, as far as the healing process goes with the ACL, there's a lot of extra therapy that you can look into. One is a new laser that's been approved by the FDA, and a lot of sports teams are using it. It's a cold or low-level laser. It increases the healing process very quickly, and of course reduces the potential for scar tissue and any type of scar buildup around and inside the knee joint as it's healing, which can increase performance. So a couple things to think about. And then, of course, your diet is going to be a key. The food you put inside your body can increase healing. Vitamin D is really important. You can go to your primary care physician, and when they typically run your blood work, just have them tack on a vitamin D. It can be a real key player in the healing process when you're dealing with any type of joint that could have been torn and repaired. It's amazing. That and the omega-3 fatty acids, such as in a good omega-3 fish oil, cod liver oil, of course, all of those are excellent when you're looking at the recovery process. Make sure you're eating non-inflammatory foods. Obviously, you're wanting to stay away from any type of inflammation because you're trying to reduce that so the healing process can be increased. Thanks for that email. 888-283-7272. That's 888-283-7272. You can check us out on the website, and there you can sign up for Facebook and Twitter, of course. Stay on top of everything going on with the show and everything going on in our company as well to empower your health and your life. And don't forget, you can always get our email newsletter that comes out each and every week. Let's go now to Elaine. Hi, Elaine. Good to talk with you, darling.
And good to talk to you. I've always heard you talk about vitamin D, and I went into the doctor the other day, and he told me my vitamin D was down to 12.
My goodness.
And I didn't know I never thought to ask him if there's something I can eat, or should I just take vitamin D, or what is the best way to get this built up?
Well, did your physician, did they talk to you about options? Did he suggest supplementation, or what did he tell you?
He just told me to take like 5,000 units a day.
That's good. That's good advice.
Is it?
Yeah, but make sure there's a lot of different vitamin Ds out there, and of course, not all vitamin D is the same, and the absorption of vitamin D is a real key. So you just, if you go out to a local discount store and you get vitamin D tablets for $10, you're going to get $10 worth of supplements, if you know what I mean. As far as it may say 5,000 units in the gel cap, but they're not really regulated, and so the absorption and whatnot. I mean, it may be good, it may not be. So the quality is questionable typically. There's a bioidentical liquid vitamin D that I'm a big fan of that absorbs very well. You always want to take vitamin D2 with meals. Some people say you can just take it whenever, but not really. It's a fat-soluble vitamin. And fat-soluble vitamins usually absorb better when you take them with food and when you have a little bit of fat in the meal that you take it with. So it can rapidly absorb into the tissues, and the body can utilize it much better. So a lot of times it's good to take it if let's say your evening meal contains a decent amount of fat in it, good fats, of course. Then it can be really good to take the vitamin D with dinner. it's typically a good way to do it. I'm a bigger fan, personally, for myself, of doing things daily and keeping up a daily routine and not doing like a one-hit wonder and then letting it dissipate out. Plus, there is no evidence as far as it being hard on your kidneys, where vitamin D toxicity could be hard on the kidneys. And that's something you want to keep up with. And that's why getting the blood test done, at least with vitamin D, every 6 months, typically. You want to get to your physician, get the blood work done, make sure that the numbers are where they need to be, and that way you can stay on top of it. When you talk to your doctor, make sure that they know that they keep your numbers, and talk to them about this, but keeping the numbers between about 70 and 90 is a good range. And that's the upper end of the normal range. And so it will help with a lot of issues. Osteoporosis, it helps with hormones, energy levels, immune system. It's one of those wonder nutrients that we all see. All right, thanks so much for the call. 888-283-7272. That's 888-283-7272. You ever heard of the white coat effect? Now, a lot of people have. It's when you freak out when you go to the doctor, and because of the white coat, you think there's something going on. You're getting, when we were kids, we thought we were getting a shot. I was with a physician the other day, and we were seeing some patients, and it was unbelievable. I mean, it was just so funny. And not funny, it was sad, but I remembered being 6 years old. I mean, you can remember being that young and, seeing them, just a child that young, just terrified. And it was just amazing. So it's one of those things they call the white coat syndrome. And we've heard about it. We've probably all experienced it at some time. But they're doing a study now, and they've found that things like hypertension, different diagnoses, and different health challenges could be a common side effect of the white coat syndrome. And they're saying in a study that potentially physicians could be overprescribing the blood pressure medication without having the patient go and double check the blood pressure and get extra readings to make sure that it's not just something that might be going on inside, just the doctor's office. It could be just a reaction, a stress reaction, or a slight anxiety reaction. But they're doing a study at Duke University and Durham, Virginia Medical Center, and they're reporting that blood pressure readings taken in doctors' offices were consistently higher than those taken at home or in a research setting. Doctors largely rely on one or two blood pressure readings taken in their offices to determine if patients need treatment for high blood pressure, and this is standard, or if hypertension is adequately controlled on medication. The researchers concluded that repeated measurements taken at home may give a more accurate picture of blood pressure control than a single reading in the doctor's office. From hour to hour, from day to day, they said in the study. And the study included 444 male veterans being treated for hypertension who had blood pressure readings taken at 3 different settings, a doctor's office, and one in 3 patients had either consistently controlled or uncontrolled blood pressure across all 3 settings over the 18-month study. And the researchers concluded that blood pressure needs to be tested 5 or 6 times to give the best estimate of the patient's true status. And I agree with that. That's a fantastic study. And that is a great study that combines behavioral medicine, really, and our environmental medicine with what happens in the doctor's office. I think there'll be more on that to come.
Want to turn back the clock 15 years and have more energy? This is Dr. Asa telling you to just breathe with LiveO2. LiveO2 delivers the right amount of oxygen we need for optimal health. Go to liveO2.com. That's liveO2.com.
To find out more, connect with On Call Radio online at InShapeNetwork.com.
Lines are open, 888-283-7272. That's 888-283-7272. Check us out. Amazing to me, there's a skin condition called eczema. We've all heard about it. If you don't know what it is, eczema is actually a skin condition where they call it more of an itch that happens to have a rash, is the way they put it many times. In a medical setting. And basically you'll have these little patches of skin that are eruptions that will they will itch so bad. And of course it makes the skin burn, and they can be in little rings or they can be in little patches. They turn red, and it can be very, very painful. A lot of times topical steroids are what are used to calm that down for about 7 days. And that typically works as far as to get rid of the symptom of it. But the root cause, a lot of times, even in traditional studies now, they're saying that there's a link to potential food allergies and a lot of what's going on inside the body, which they're saying there's no direct cause that they're saying, but they're saying it could be a strong link. But, the realization is that skin conditions are an inside-out thing, not an outside-in thing. And so we typically treat, or most physicians typically will look at, and they will typically, the standard of care, I guess is the better way to say that, is to use topical creams and, of course, the steroids, corticosteroids, and they do get good relief. There's a lot of different theories behind it as far as, elimination of certain foods, tomatoes and wheat products, cow's milk, dairy, which I'm a big fan of. I think that's one of the best things that you could do, in my opinion, when you're dealing with any kind of skin irritation, is to clear out the gut. You clear out the gut, you clear out the skin. The skin's the largest organ we have, and it's a great reflection of what's going on with the skin typically when something's going on with the gut. But just interesting, I was reading a study the other day about eczema and just all the different creams and whatnot that they're using for that. And again, when we look at what we're extremely deficient in our country today, like omega-3 fatty acids. Omega-3 fatty acids are so important for the health of our skin, for the health of our gut, for cutting down the inflammation within the body. And our kids, which are the big culprits. I have a friend that is a physician, and she began giving her daughter the omega-3 fats in the cod liver oil, and was suffering with severe asthma, and eczema. And the child began to do very well. I talked to some pediatricians as well that have been implementing some of that. So it's interesting to see, and you see the studies out there now where they're talking about a lot more of the natural type of items, I guess, to be able to help the body. And we're going to see that more and more. But again, a lot of people right now, eczema is interesting because it really does have a strong, like they're saying, and I agree with the evidence-based crowd, and they're not going to directly say that foods directly cause eczema. They're not going to say that because there's no direct study yet. But I believe it will come. But just know that food allergies are linked. And in just a moment, we're going to talk about how food allergies are linked to more issues in health than we originally thought. So, but right now, we're going to go to Carolyn. Hi, Carolyn. Welcome to the show.
Hi. Thank you so much for having me.
Absolutely.
My question is, I have just completed 6 weeks of physical therapy for my right knee, which I had an arthroscopy on March 31st.
Okay.
I had 2 large meniscal tears at that time. My therapist says that even though I have improved, I still have a very valgus knee, and that I'm probably looking at a knee replacement. Any advice, help would be greatly appreciated.
Well, you've gone through all the physical therapy, and I guess they're happy for the most part. Have they said that you come through the therapy plan that they've laid out for you very well? Are they pleased with that?
Yes. And everything that I have completed, I've done well with. I have gained strength and muscle tone back in. The glute and all of the muscle structure around it. By the way, I do have psoriatic arthritis also.
Okay.
But anyway, the knee remains swollen. I continue to have stabbing pains in it. It's very unstable. So she said that I have completed. There's really nothing else. Everything that they had to offer, I completed it and done really well with. Continue an exercise program at home. And she said there really is nothing else that she has to offer.
When you had the knee, Carolyn, when you had the knee scope, what did they work on? Were they working on the meniscus? Were they working on an ACL? What were they doing?
No, I had 2 very large meniscal tears, one on each side of the joint.
Okay. So they went in there and repaired that. And then, of course, supposedly everything is well, but you still got a valgus shift to the knee, and they think that it's causing it to be a little bit off track, and that's what's causing the inflammation. Is that right?
Correct.
Okay. So you're asking me what's the next move, but I want to ask you, what have they told you is the next move from the PT perspective and from the orthopedic surgeon's perspective?
I see the orthopedic surgeon this week. I just did not want to go back because I couldn't get it in my head that I needed a new knee. And my physical therapist, who I've known for 15 years and have used for other problems, the physical therapist has just said it's time.
Are you overweight?
Well, I'm 5'8" and I weigh 175.
That's not. I mean, that's not. It is overweight, but it's not just over the top. I mean, you could stand to lose at least 30 pounds, probably. Would you be saying
Well,
that?
I'll tell you what wrecked my knee. I had a severe bad back for 25 years. I had an incomplete diagnosis and found a surgeon 3 years ago who fixed it completely.
Oh, that's great. Well, I mean, I think the next best thing is, I know you don't want to hear that it's time, but if the people around you are telling you it's time, I mean, they are the ones that are looking at the different diagnostic testing, they're looking at the x-rays and the MRIs and whatnot, and they're doing the follow-up. So again, it's all about how much tissue has been degraded and you know how the degeneration all around the knee. There's a lot you can do to increase the joint health, and you know that might be able to buy you some time. And I would talk to if you're going to your orthopedic surgeon, I would talk to them about that. Your eating plan is going to be important, but again, it's not going to regenerate the cartilage and everything that's in the knee overnight. There might be some things that you can do to see if you can buy yourself maybe another year. But I would talk to the ortho about that and then do some research. And if you want some more information there, but I would go first to the orthopedic surgeon, get their full viewpoint based on the testing. And then if you want to shoot me an email, be glad to do that. We'll be right back.
Want to turn back the clock 15 years and have more energy? This is Dr. Asa telling you to just breathe with LiveO2. LiveO2 delivers the right amount of oxygen we need for optimal health. Go to liveO2.com. That's liveO2.com.
To find out more, visit the show online, InShapeNetwork.com. Connect with On Call Radio and watch On Call TV at InShapeNetwork.com.
Talking with John. John's been dealing with a couple of issues, just trying to figure out what to do. One is a shoulder that the rotator cuff has just become a little bit lax or a little bit loose, and then a little bit of degeneration in the lower back with one of the discs, and just looking at options, what to do. Do you do surgery? Are there more natural methods that you can approach first and foremost before you go that route? And we were just discussing that. So, John, my thought is for a shoulder and for the lower back, first, number one, you always want to look at someone and say, okay, are they overweight? You're not. So that's step one, which is great. And so you've got that battle beat. That's not an issue. And you've been dealing with a loose shoulder for a long period of time. It's kind of bothered you, and there's certain exercises like in the gym that you can't do, and there's plenty that you can do, so you just work around it. And you said that you've done physical therapy, and that's where we left off. And so did that help you at all going to PT? Did doing the rotator cuff exercises feel like it strengthened the shoulder up and made it stronger or not?
It helped in the surrounding area of the shoulder, but I still definitely have limitations of things I want to do, like play throw a baseball and stuff like that. And even though things like that still limits me. I can probably live a normal life, but it may need to be structurally corrected. I'm not sure.
Have you gone to an orthopedic? Have they gone in and said, hey, it would be nice to go in and maybe to scope it and go in and clean it out? Have they even mentioned that to you?
Yeah, that's probably what it is. I think inside, deep down, I'm one of those people, because I know I'm not too familiar with scoping. It's definitely better than the old day, but maybe I'm one of those people who's afraid to go under the knife. But maybe that would be probably a good option, because a lot of the arthroscopic surgery stuff is actually pretty darn high tech and pretty good now. Maybe deep down inside, maybe I just had a little bit of a fear about it.
Yeah, it is. It's definitely new school. It's not old school for sure. I mean, the way that they can go in and look at it. I mean, the MRI of the shoulder, they can take a good picture and they can have a pretty good gauge of what's going on inside, and before they ever do that. And they can even, so just know that. I mean, that's one tool that they can use for sure, and they'll do that before they ever decide to go in. The other is the lower back. Let's talk about that for a second, because I'm not a big fan of back surgery unless literally you can't move, or to the point where you almost can't move. And you're just taking so many pain medications, it's ridiculous. So, so where are you with the back? With the back pain, are you at a place where it's that bad, or
You know
No.
what? I can walk. I can still do a lot of things, but I can feel like I can feel it hit my nerve on occasion. It's more or less something I can deal with. But they said it is that one particular disc is starting to wear.
Who's they?
So apart. An orthopedic surgeon or a neurologist or something like that.
Okay.
And they said it's sort of wearing. I always think to myself, geez, am I going to end up having to get a fusion for this one thing? I didn't know if there was any other options, because I always think, well, fusions or disectomies and stuff like that. Does the back reject these foreign bodies and stuff like that? So I just didn't know what was out there. I mean, so
well, it depending. The fusions sometimes. I mean, you just don't hear of a lot of the back surgeries turning out great.
I know. Yeah.
Some do, and I'm not discounting that, because the surgeons that do the back surgeries are unbelievably skilled. I mean, it's just amazing, and it's not really their fault. It's just it really comes down to the anatomy more than anything. But the other issue, first and foremost, have you done any physical therapy on your back, or have you gone to an osteopathic physician or a chiropractic physician and gone that route?
I have went to the chiropractic physician, and it worked marginally.
Okay.
The osteopathic I haven't tried too much of. And the physical therapy, I will say it does help. So I guess in a sense that with physical therapy, it's something that I have to be more, how can I say, religious about.
Yeah.
To really to stabilize.
I would do that. I mean, this is just my thought. If you're getting some relief, I would consider, physical therapy would definitely be a good thing to consider. If you've gone to the chiropractic physician and that treatment didn't work, let's say you gave it a good solid 2 months, okay, which is a good amount of time. I would say a month and a half at least. If that treatment does not help in that amount of time, it's not going to help, period. And so to string you along for a long period of time is not a good thing to do. Now, physical therapy, for a little bit long period of time, there's validity to that, I think. The osteopathic physician you might want to check out with the DO. It's going to be very similar to chiropractic, so there may not be, in that regard, there may not be a lot of relief. There's a really good treatment out called decompression therapy. Very good. And some people, here's the deal. You do about 15 to 20 treatments on it. Some people get amazing results. Some people get marginal results. And again, when you're facing surgery like back surgery, you want to exhaust every option that you have. And that's really the concept here. And so that's why I want to encourage you. You've done, some treatments with certain physicians, but I would explore all of those before you ever go down the surgery option. So you want to feel like if you ever go to surgery, you want to feel like I have done everything in healthcare known to man that there is, and it didn't work. Here's another issue. A lot of joint pain can be linked to stress. It can be linked to neurotransmitter instabilities. Nutrition plays a big role. Vitamin D plays a big role. So if you've got deficiencies nutritional deficiencies in the body that blood work has not shown, always get some type of blood analysis done by your physician for nutritional components and make sure you're not deficient, because that can cause and mimic joint-related pains in the body that may not have anything to do with anything. And that could be causing and mimicking a lot of this pain that could be taken care of quite easily. So again, it's about looking at the body as a whole. Don't just focus narrowly on the joints, but look at the body as a whole, and that's the best way to go. Thanks for the call. Puts another hour in the charts. I'm your health and lifestyle coach. Go tell one person something you learned on this show, and together we can change the health of our friends, our families, and our communities. You're listening to the best in healthy talk radio, where we're diagnosing hope one person at a time.
Did you know you could listen to the ASA RX audio experience on Spotify and Pandora? For all the ways to watch and listen, check out our show page at asarx.com/experience.
Hi, it's Asa. I'm giving you a copy of my best-selling book for free to help you in your health journey today. I'll pay for the book. All you do is just cover the small shipping and handling costs. Go to asarx.com and get your free book today.
This episode is over, but check episode notes for links to products and services you've heard about on this episode. Thanks for listening and subscribing. Please share the ASA RX audio experience with others and stay in touch by giving us your comment or review.